Hi, my name's Brooke Flanagan. I am a first-year paramedicine student currently studying at the University of Tasmania on the Rozelle campus. I am very excited to share with you today my thoughts and research on how cultural backgrounds can have a significant impact on the health and illness of individuals. Timely knowledge defines a cultural background as the context of one's life experiences as shaped by membership in groups based on ethnicity, race, socioeconomic status, gender, exceptionalities, religion, language, sexual orientation, and geographical area. In relation to the healthcare section, your cultural background can have an immense impact on your health, as it can determine your access to healthcare, health-related behaviour, along with your perception of your own health. Kavajova et al. 2022 states that a belief is an attitude that something is true, and as such it is considered to be the simplest form of mental representation. Cultural beliefs determine the different ways in which people view medical treatments. The role cognitive factors play, such as beliefs in health-related behaviour, is significant. This means that our health outcomes are partially based on what our cultural beliefs entail. Additionally, Kavajova et al. 2022 states that the belief in the validity of ineffective treatments can be detrimental, as it can lead to poor health-related behaviour and in turn poor health outcomes. Some of these behaviours include refusal of vaccinations, treatment of disease with homemade remedies, and religious acts such as holy water. An example that brings light to the significant impact that cultural beliefs and backgrounds can have on an individual's health is the R versus Blau case 1975. This case involved a woman who was involved in an attack, where in order for survival, a blood transfusion was needed. However, a direct result of her cultural beliefs being Jehovah's Witness led to her refusal of this life-saving intervention, where she later sadly passed away. This portrays exactly how your cultural background and beliefs directly impact the decisions made surrounding your health. This example, the difference between life and death. Another factor of cultural backgrounds is geographical location. This can affect individuals' access to healthcare, education, and basic needs, ultimately affecting their health outcomes. Taylor 2019 states there are striking spatial injustices in health between rural and urban communities. Additionally, geographic factors provoke health disparities within and between cultural groups. Further research by Taylor 2019 states that individuals who reside in rural areas are susceptible to higher mortality rates than those in urban areas. Access to education and medical institutions are also affected by geographical location. When people have a low education status, their ability to make appropriate decisions on their health is reduced. This ability is referred to as health literacy, defined by Gonzalez-Chica et al. 2016 as the cognitive and social skills possessed by the individual that enables them to appropriately access, understand, and use health information to maintain good health. Research by Taylor 2019 found that people residing in rural areas were seen to have fewer dental checkups, cholesterol and cervical screenings compared to urban residents. With these preventative measures being recognized as crucial, as they can significantly reduce mortality rates, rural residents face significant health disadvantages. This further portrays how geographical location can impact individuals' access to healthcare. Another factor of cultural backgrounds is socioeconomic status. This is an important determinant of an individual's access to healthcare. With a low income, access to superior healthcare is reduced, and in turn, so are health outcomes. McMahon et al. 2020 refers to this as a vicious cycle, where poverty reduces access to healthcare, leading to increases in morbidity, which leads to reduced access to care, leading to increased morbidity, ultimately leading to reductions in access to care. He further states that during a study, costs of medical care were cited as the main reason for not obtaining required health care. This means that the need to buy expensive medicines, food, and attend checkups to maintain good health is unattainable. In addition, preventative measures such as screenings and checkups that are vital for early diagnosis and increased survival rates are unavailable for low-income individuals, increasing premature mortality. Overall, this highlights how socioeconomic status can affect individuals' ability to access and maintain healthcare. The interventional and life-saving treatments which paramedics can supply to the public are undoubtedly vital to patient outcomes. The nature of the emergency responder setting is uncertain, in which there are many factors that can influence paramedics' decisions on patient care. Henderson 2013 states that this complexity is based on the physiological and psychological needs of the patients. Paramedics must obtain the ability to communicate with patients from a range of cultural backgrounds. This may prove difficult in circumstances where a patient is unable to communicate effectively due to poor health literacy or poor education status. This could mean paramedics aren't fully able to understand the patient's situation and are therefore unable to provide adequate treatment. A patient's socioeconomic status may also pose a personal conflict with paramedics, as the patient may be in dire need of assistance. However, they could be expressing concerns that they cannot afford this healthcare and therefore reject paramedics' assistance. To conclude this presentation, I would like to highlight that cultural beliefs, geographical location, and socioeconomic factors can have immense impacts on individuals' ability to access and maintain healthcare. Overall, this highlights how an individual's cultural background can have significant effects on their health and illness. Well, that finishes off my presentation. Thank you so much for watching.